Hi, I'm Dr. Drew Duquette. Thank you for requesting this DVD. On this video, I'm going to introduce you to the functional medicine approach to chronic complex disease. Real answers for people who suffer from diseases such as type 2 diabetes, fibromyalgia, irritable bowel syndrome, migraine headaches, autoimmune diseases, thyroiditis, autism, ADD, ADHD, and so forth. I'm going to specifically talk about the causes and treatments of three common conditions: fibromyalgia, migraines, and irritable bowel syndrome. Now, I've grouped these conditions together because, as you will see in a moment, they're all related neurologically. In other words, they share some common root causes. Okay, let's get started. What is functional medicine? Functional medicine is the assessment and treatment of chronic disease by addressing the underlying cause or causes of that disease. Traditional medicine treats only the symptoms of disease. This approach is what makes me different than any other doctor that you've been to and what makes my program so successful. Functional medicine does not treat conditions or its symptoms. It uncovers and treats the hidden causes. Now, some common causes of chronic disease may be hidden infections, food allergies, nutritional deficiencies, toxicities, physical and emotional trauma, adrenal dysfunction, and neurological weaknesses. Once the cause is determined and then treated, the condition with all of its symptoms simply vanish. Now let's take a closer look at three conditions that millions suffer with: fibromyalgia, migraine headaches, and irritable bowel syndrome. The causes of fibromyalgia, migraines, and IBS are divided into two categories: neurologic and metabolic. It would be one or the other, or a combination of the two, depending on the individual. So let's discuss the neurological causes first. But in order to talk about the root neurological cause, we first of all need to know a little bit about how the brain works. Normally, the back part of the brain, called the cerebellum, fires strong impulses to the cortex of the brain, which in turn then fires strong impulses to the lower brainstem, which then fires impulses to the upper brainstem, called the mesencephalon. The impulse from the lower brainstem to the upper brainstem governs the upper brainstem's output, keeping it calm and quiet. That's its job. When this impulse strength of either the cerebellum or the cortex of the brain has been weakened, this important electrical loop will be broken and the lower brainstem will not receive enough input. Without the proper amount of input, the lower brainstem will not be able to quiet the upper brainstem, and it becomes overactive. It is this overfiring of the upper part of the brainstem that is the link. That is a common cause of migraine, headaches, fibromyalgia. When this overfires, the adrenal glands, which sit on top of the kidneys, release chemicals called catecholamines. These compounds circulate all over the body, stimulating pain fibers. This is where the migratory pain from fibromyalgia comes from. That's why one day the pain may be in your neck, the next day it might be in your shoulder, and the next day somewhere else. It is this overfiring which also causes blood vessels to constrict and rapidly dilate. This is where migraine headaches originate. It is this overfiring that can cause a myriad of other related symptoms, such as light sensitivity, insomnia, heart palpitations, depression, anxiety, frequent bladder infections, and the list goes on and on. That's why it's called migraine syndrome or fibromyalgia syndromes. Now, when it comes to irritable bowel syndrome, Crohn's, and colitis, it is the lack of input to the lower brainstem that may be contributing to the problem. When that impulse loop to the lower brainstem is lost, the vagus nerve, which comes out of the lower brainstem and goes to the bowels, does not fire very well, and the bowels become stagnant and inflamed. This results in constipation, diarrhea, and severe GI pain. People can suffer from one or more of these conditions depending on which area of the brain is involved. Some folks have only migraines. Some have migraines and full-blown fibromyalgia and IBS. Some people may only have IBS or Crohn's and nothing else. The symptoms may be different for everyone, but the neurological cause is the same. a weakening of the cerebellum and or the brain's cortex. Now let's talk about the metabolic causes. Metabolic imbalances causes stress on the body's delicate systems. Stressors such as food allergies, hidden infections like yeast, bacteria, viral, parasitic, etc. Toxicities like heavy metal or petrochemical, dysoxygenosis, poor blood sugar, adrenal dysfunction, and nutritional deficiencies. Depending on the person, it may be one or several of these stressors that is to blame. These stressors not only directly cause fibromyalgia and migraine headaches and irritable bowel syndrome, but in addition may indirectly contribute neurologically to the weakness of the brain's cerebellum and or the cortex. One feeds the other, creating a vicious cycle that ensures the problem gets worse over time unless properly corrected. That's it. That's what this whole mess is all about. Metabolic and neurological imbalances. So what can we do about it? In this next section, let's talk about treatment. Treating the causes of migraines, fibromyalgia, and irritable bowel syndrome, as you have already learned, is divided into neurological treatments and metabolic treatments. The neurological care is accomplished with in-office treatments and at-home brain-based exercises, both of which are designed to strengthen the weakened parts of the brain, getting that all-important loop going again, strengthening the lower brainstem and quieting down the upper. Most of these brain-based exercises are done while on enhanced oxygen. That is an oxygen concentrating machine. Like when athletes want to speed muscle growth and repair, they used enhanced oxygen while exercising. And this works just as well on the brain and nervous tissue. Incidentally, this regrowth of brain cells is called neuroplasticity. We utilize exercise such as specific eye movements, sounds in either the right or left ear, olfactory, certain smells in the left or right nostril, and exercises that stimulate the brain cortex, like viewing familiar objects, faces, mazes, puzzles, or cerebellum exercises such as squeeze ball or upper body ergometer for either the right or left extremity, and all again while under enhanced oxygen. That's how you repair and strengthen those weakened areas of the brain. Now, depending on the individual and the results of their neurological test, several of these brain-based exercises will be prescribed. In-office treatments, such as unilateral manipulations, warm water calorics, auriculotherapy, percussion, and heat may also be used. That's the neurological side of treatment. Now, for the metabolic side of treatment, we prescribe lab-determined pharmaceutical-grade supplements designed to correct nutritional deficiencies, eliminating hidden infections, clear toxicities, eliminate food allergies, and repair adrenal and blood sugar problems. And since diet and lifestyle are so very important, a certified health coach will also be an integral part of care. So as you can see, like I've said before, we will leave no stone unturned in determining the exact cause of your problem. And that's why this program is so successful at treating chronic complex diseases. Ask yourself the following questions. How has this condition affected your job, relationships, finances, family, or other activities? What does it cost you in time, money, happiness, and sleep? And where do you picture yourself or your loved one in the next 1 to 3 years if this problem is not taken care of? And what is it worth to you if your condition could actually be improved or resolved? If this approach of treating the cause makes sense to you and you're really serious about this alternative treatment, contact my office today. I'm offering 2 free visits to determine if you are a candidate for care in my office. I do not accept all patients. I only accept those patients I believe I can truly help. Thank you for watching. I'm Dr. Drew Duquette.